In its continuous commitment to safeguarding quality healthcare delivery and promoting compliance with regulatory standards, the Health Facility Regulatory Agency, HeFRA, embarked on a 3-week monitoring and enforcement exercise across the northern sector of Ghana. On 29th June 2026, a team led by the Deputy Registrar of HeFRA, Professor Vida Nyagre Yakon, departed the Greater Accra region to undertake this important assignment. The team comprised the Director of Compliance and Enforcement, Dr. Ajuman Bedu, the Acting Head of Registration, Nicholas Yombe, Secretary of the Deputy Registrar, Elinam Menuhu, and Nat Kofi Agri from the Public Relations Unit. Upon arrival in Bolgatanga, the team was welcomed by the regional coordinator, who assisted with the necessary arrangements to ensure a smooth start to the exercise. The team began its engagement with a staff meeting involving officers within the Upper East region, followed by a strategic meeting to discuss the approach, objectives, and operational modalities for the monitoring exercise.
And the next one, HealthNet.
Yeah, HealthNet also hasn't. No license.
Where is it located?
It's in Bolga and one at Paga.
So two Bolga and Paga.
Yes. We didn't have this, so we'll be adding this, and these ones are also to be at Bolga Municipal.
Paga.
5 and Paga.
5, in Novrongo and Paga. Paga is 1, and Novrongo 4.
Okay. Then here 8.
8, and then Talesi 2.
So how many are they in all?
So 2 here. Plus 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
First and foremost, this exercise is both financial and compliance and enforcement. Now the issue is that there are people or facilities who may not have license at all, or have had their licenses expired 4 years, 5 years. Because they've heard we are coming, they will come and pay their statutory fees. The condition is that you are working without license and you don't operationalize the place before you come for license. That's the message you want to put out there. The other thing is that normally you may be looking at these facilities and say Navrongo, but whenever we get there, we just Google facilities near me. Others may pop up which are not even on this list. We attend to them as well. So that's one of the strategies you also use. Herbal facilities with orthodox services. Because of the fact that we are promoting interagency collaboration, normally we alert them that we have found a facility of theirs which is into orthodox practice. There are two things. When we went to Germany, Volta region, because it was far, they told me to lock it up on their behalf. But if they have an office here in Upper East, we may want to do joint this thing to give out the message that we are not, antagonizing each other. We are promoting regulatory harmony, so that all the two of us will be there, we apply this thing. Prof, I appreciate the points you made about the hard-to-reach areas because of the conflict. Is it the case that we'll be going there with the police?
Oh yes.
So which places are those?
We are going to the Kusuga and the rest.
We'll go to Benduri, Kusuga, Garu, Timpani, and even Boko Municipal. Some now divided into 2. There's one portion we can go on our way.
As part of efforts to create awareness and engage the public, the team visited Dreams FM in Bolgatanga to educate listeners on HeFRA's mandate and the importance of health facility regulation.
I'm wondering if it's on campus or outside campus. How can students think that way? Now let's engage HeFRA. Good morning. How are you all?
Good morning.
Okay. And then it says Doc. It's Prof, right?
Yes.
Okay. But I see Doc all the time. Welcome to the show.
Thank you so much.
Great. Those of us who are not aware of HeFRA, you give us a background of who you are and your mandate, Prof.
Thank you so much for having us, and thank you to our cherished listeners out there. We're happy to be here. So, for the benefit of the doubt, HeFRA stands for Health Facilities Regulatory Agency, established by law, Act 2011, Act 829. Our mandate is to ensure that every Ghanaian, wherever you are, access care that is safe and quality. Now, by so doing, it means that we need to regulate how health facilities get established and how they function. And so, before a health facility in this country, whether private, public, or CHAC means Christian Health Association of Ghana. So those facilities that are owned by faith-based institutions, they are registered, they are licensed, and they practice within the law. They maintain standards, and if standards are not maintained, what will happen is that they get sanctioned.
In line with established protocol, the team paid courtesy calls on key stakeholders in the region. These included the Regional Director of Ghana Health Service and the Upper East Regional Minister.
Yes, I'm Professor Vida Nyagre-Yakong, Acting Deputy Registrar, HeFRA. We are in the Upper East region today to undertake monitoring compliance activities of the region. We are setting off to have a courtesy call visit with the regional minister, the regional health director, municipal health and district health directors of the respective districts that will be undertaking these activities. Today mainly we'll focus in the Bolga, the central of the region. Then we carry on to the rest, Navrongo district, Boku, Talense, Nabdam, and we are hoping to be able to cover approximately 95 facilities for 5 days that will be here. We hope to achieve this, and I think it is more or less the first time that we are doing this comprehensive monitoring and then compliance activity in the region. So it's really an important activity today, and we hope to cover all of this. Good morning. Thank you. We have an appointment.
The team's first stop was the office of the Director of the Ghana Health Service in the Upper East region, Dr. Barema Baba Abubakari.
Good morning.
Good morning.
Good morning once again.
Yeah, good morning.
I think we'll just introduce ourselves.
Okay.
Then we can begin the conversation.
Yes.
Yes.
So that's Dr. Samuel Bora, the Deputy Director in charge of clinical care.
Yes. I think I know him.
Okay, she's going to introduce herself, but
So I'm as he said, Prof. Vida Nyagre-Yakong, Acting Deputy Registrar, HeFRA. So I'm here with the team, and I'll allow them to introduce themselves. Okay, so we can...
My name is Aminofi Elina. I am the Secretary to the Deputy Registrar.
okay.
I'm Matilda Zop.
Regional Office, HeFRA.
No.
Director of Compliance and Enforcement.
Okay.
Nicholas Yonde, acting registration center. Zoe Joseph, the advice is HeFRA.
Okay.
So our being here is to carry out some of our activities for monitoring compliance and enforcement. We are going to try to cover the most part of the region.
Okay.
Most of your facilities and your facilities in terms of the government facilities are going to be part of this monitoring and then enforcement activities. We already have a list of facilities that are likely to be closed down. As to whether your facilities will be part or not, I don't know yet. Basically, this is our mission. So I'll let the Director of Compliance and Enforcement maybe add a few words.
Thank you so much, Prof. So as indicated by Prof, we are essentially here to ensure that facilities offering health services in your region are HeFRA licensed.
Yeah.
We have been accused in the past that we are too soft on public health facilities. We will engage as we move along to see if there are any of your facilities which are involved. I know last year or last 2 years, through the support of one of the donor partners, we were able to license all CHIPS compounds.
Yeah.
I think we have also done some health centers in the past. As a regulator, one with human face, where we don't need to be too hard on the facilities, but coach them, we will do that.
Yeah.
But there will be certainly some recalcitrant facilities. We need to apply the padlock and chain. That is basically why we are here.
Thank you very much for the visit. Because for us it's to enhance what we've been doing. Because to get the quality of healthcare, I'm sure it's directly in line with what you are looking for. Fortunately, he is the one who has the quality management unit, because the regional quality focal person works directly under him. If you look at the accessibility for now, because of the CHIPS concept, we say there has been remarkable improvement. People don't need to travel very far to be able to access healthcare. The question now is the quality of healthcare. And I'm sure when you come in as a regulator, we don't carry the sanction in our hand. But they say usually a dog doesn't bite its puppy and reaches the bone. Is that not it? You can see the teeth there, but it doesn't beat hard to reach the bone. So they are our facilities, but the people we serve to deserve a better care. Even NHIS, where they have a reward for having an active license, they still fail. So a time comes, they are not able to submit claims because NHIS credential is expired. But those ones, they find ways and means of submitting the claims. But your part, that one you cannot have a license in the name of another facility. So it's a good thing, we welcome it. And as sister agencies under the ministry, we'll give you all the necessary support to ensure that our facilities they are up to date with their credentialing.
The next stop was the office of the regional minister, Honorable Akomori Donatus Katanga, to officially announce the team's presence and strengthen collaboration with regional authorities.
Acting Deputy Registrar. Basically what we are going to do is to do monitoring, do the compliance aspect, and then enforcement. And that is facilities that are not complying are likely to be closed down. And then we'll look at how they can be supported to do what is expected. And this is a routine thing. It's not anything that is unusual. So we're expecting to cover most parts of the region. About 95 facilities will be covering, and all of this is to ensure the safety and quality of health service delivery to every Ghanaian. It is important that as a regional minister, you are aware when these things happen, the next is that they are going to be calling you. And so if you are already aware of it, you can also add your voice to the importance of it. So I'll let the Director of Compliance.
Thank you, Honorable Minister.
Yeah.
So, like earlier indicated, we are here to make sure that one of our mandates, which is to make sure that facilities come under regulation. That is, some facilities, we don't even know them. They just sprang up and they are offering services. But there are others who have HeFRA license, whose licenses have expired and they decide not to come under regulation. There are others who have subsisting licenses, but they have added services we didn't license them to do. And of course, there are other facilities to which are offering traditional medicine practice, but they have added orthodox. So technically they are not under us, but we realize that they are doing labs, they are doing ultrasound scan, which is not traditional in any way. So all these things we want to ensure that where we need to co-regulate with the sister regulator, we do that. Where it comes directly under our mandate, we make sure that people offer the services according to the standards that are set for every facility type. Where facilities are challenged and we have to close them down, we will close them down and still support them to come back under regulation so that our people will be assured of the quality of air they deserve.
Yeah, thank you, Madam Vida, and your entourage. We are more than happy to have you in the region today. I've been a while on this earth, but I have not witnessed any organization going to monitor and check whether those who are providing us our health needs are operating within the law. And so now that we have the HeFRA in the region and we are bent in carrying out those activities, every citizen in Upper East region ought to be happy. As I'm seated, I'm not a medical doctor. If somebody decides to come on my way out of my sickness and administer something that is not good enough for my health, I'll pick it in without knowing the causes. And so if you have an organization that has carried upon themselves to ensure that people are protected, and in fact I should call this a protection move, not compliance, because you are here to protect the ordinary people, you are here to protect them from being caused any harm health-wise. And so in that regard, we are absolutely behind you. As a leader of the region, when you come, what I also know on the ground, I have to share with you. But in this case, don't take it to be the living preaching to the ghost about the kingdom of the dead. On that note, I thank you so much for coming.
So we won't take so much of your time, but we will keep you updated.
My name is Dr. Ajumambedu, Director of Compliance and Enforcement. This morning, our itinerary will be taking us to see the regional police commander and to seek their blessing, as the case may be, to carry out the exercise. Following that, we will be visiting some earmarked facilities for enforcement in the Bolga municipality, and also hopefully proceed to Navrongo.
Yeah, for the past 2 hours or so, we've been engaging the regional director of health services and then the regional minister. They give us that, the opportunity to do what we are here for, that would support the region move forward in terms of health service delivery. We are here for about 5 days, so each day, because they are the custodians of health service delivery in this region, so whatever happens, I think facility owners are going to call them, and they are likely to also be calling. So we promise to give them that feedback so that together we see how we can collaborate and then make this activity a successful one.
The monitoring exercise covered a total of 93 health facilities across the Upper East region and focused on assessing compliance with licensing requirements, operational standards, and regulatory guidelines established by HeFRA.
Thank you.
Good afternoon, sir.
Afternoon,
So we are a team from Health Facilities Regulatory Agency. We want to inspect your license.
During the exercise, 20 health facilities were closed for operating outside the regulatory framework of the agency and failing to meet the required standards for healthcare delivery. Among the facilities affected were Equate Medical Laboratory, with 2 branches in Bolgatanga, which were both closed for non-compliance.
But for how long have you been operating?
When we came here last month. No.
Last month?
Yeah, no, last year. This is
You are
6 months. So we came here.
You came here last year, so 1 year, 6 months.
No, we are not.
So you came here which month last year? So February to date will be more than 1 year.
Yeah.
That's 1 year, 4 months. Okay. You know you need to get license before you start. So without the license, we are here to lock up the place. We are looking for the license. Do you have it?
No,
especially so that you have worked 16 months without license.
NIDA Homeopathic Clinic and Laboratory was also closed after investigation revealed that the facility was providing orthodox medical services without the required license from HeFRA.
We were doing that on the lab aspect.
And you have seen
which one?
You have seen ultrasound.
Ultrasound, homeopathic, we use it. We use ultrasound. We use it.
So who operates it?
I'm the one who was operating. I'm the one operating the ultrasound.
So what qualifications have you?
I'm a homeopath. And a homeopath, we use ultrasound.
No, so I mean, in terms of certificate to operate the scan, have you done anything to ultrasonography?
Well, I'm coming. For ultrasound, we do it. But the issue is this. When it comes to other conditions, I transfer the person to medulla.
No. Do you know Anaji?
I know.
And you are telling me this one is herbal?
No, I'm not saying it's herbal. What I'm saying is that when somebody comes with a pain.
No, but you know Anaji is banned.
No, Anaji is banned. It's true. We don't use. You don't see we don't use this one.
But it's not expired.
Master.
No,
it's not expired.
No, take this one. I will not leave this one here. And these are not herbal. Where are the rest?
Yeah, here.
No. My challenge is more with this. It's a banned drug. They are banning. So Anagen is 120. You are even giving infusions, Renges lactate and everything here. You are telling us it's herbal.
I didn't say I don't.
Herbal fasting. No, it's not about sometimes, please. You know that you are not supposed to.
The closure was carried out in collaboration with the Traditional Medicine Practice Council, TMPC.
But what HeFRA has found is that you are doing more than your homeopathy. Even if you had a license, the practice that you're practicing is outside of.
No, they asked me some questions concerning the lab. And I said we were collaborating with other labs.
My name is Dr. Evelyn Abaya Isa, and I'm the Deputy Registrar for Traditional Medicine Practice Council.
So, in the circumstances, what can you do with some kind of leniency for us?
Well, he has to get regularized. We will lock the clinic up, and then he has to regularize and get a new license. If you want to operate a clinic other than your homeopathic clinic, you need a HeFRA license. They're two separate organizations. HeFRA has its regulatory pathway. We have our regulatory pathway. You cannot get a TMPC license and practice outside of the scope of what that license gives you. The license gives you the ability to practice as an alt doctor.
Yeah, and I don't want
Yes.
to because that's what I'm saying.
You can't give injections that you are giving. We will lock it. No, the law says that if you practice without a license, we should lock you. So I would lock you when you come. No, you know, I'm already here.
We'll lock it and go. You will see that we'll lock everything and go. Then I'll come there.
No, we will lock it. We will lock. We'll come back and open for you. We're in Boga. We're here till. No, we have to. Unfortunately.
Similarly, Anicom Herbal Clinic was closed for providing orthodox services without obtaining the necessary approval from HeFRA.
The practitioners have no license. The two doctors in there, Dr. Charles and Dr. Richard, none of them can show me a license. Since 2019, they don't have a license. So we're locking them until they regularize.
Other facilities closed during the exercise include Biomedical Lab and Scan, with branches in Bogatanga and Samburudu, Welfare Lab, Rock Care Diagnostic Center, Nanasco Dental Health Care, Edmida Laboratory and Scan,
Good morning. My name is Joseph, the Upper East Regional Coordinator of HeFRA. So today we have two teams. And then one team is going to Katsina Nankana Municipal and Katsina Nankana West District. Another team in which we are going is Tanlese and Napdam District. And we are expected to monitor and enforce about 8 to 9 facilities today. However, apart from this list we will be searching for facilities on our way, new ones on our way as we go. The facility on our list here, we have Zandelugu Health Center, Pilungu Health Center, Sunrise Village Clinic, Belsa Health Services in Tanlese, and the Truth Medical Center in Tanlese. And it's an earmark for monitoring. For compliance, we have Lavely, Ultrasound, and then Awudu Barnabel Health Center.
Amedilab Services.
The lunch for the day.
Snack.
We are in the Tanlese district.
Lovely Ultrasound Scan Services. My Dove Diagnostic and Laboratory Center. Every May Diagnostic and Ultrasound Services.
So, boss, you are
BDS Laboratory in Sandama. UMS Laboratory in Sandama. Medilamp Health Services. Every Step Medical Service. God's Favor Ultrascan. Happy Diagnostic. Uzia Medical Diagnostic. Naga Healthcare. Awudu Pari Abio Health Center. However, not all infractions required immediate closure. 3 facilities were found with minor issues that could be corrected within a short period. These facilities were given the opportunity to address the identified concerns. They included HealthNet in Paga, Ikrit Medical Laboratory Sample Collection Center in Bogatanga, and Naga Health Center. The team was also scheduled to monitor 36 facilities in the Boku municipality. However, due to prevailing security concerns in the area, the exercise could not proceed as planned. Despite the challenges and infractions identified, some facilities demonstrated exceptional commitment to maintaining high operational standards. These facilities were recognized and commended for their dedication to quality healthcare delivery. They included Mohammed Medical Center in Navon, Amia Hospital in Bolgatanga Municipality, and Optical Plaza Orthopedic Hospital in Bolgatanga. The monitoring and enforcement exercise concluded successfully on 24th July 2026. Beyond identifying non-compliant facilities, the exercise served as a critical platform for strengthening healthcare regulation, improving adherence to standards, and ensuring that health facilities operating across the country provide safe, quality, and reliable services to the public. Through continuous monitoring, collaboration, and enforcement, HeFRA remains committed to protecting patients and promoting excellence in healthcare delivery across Ghana.